When you talk about omega-3 amounts, can we get too much?
Yeah.
And have you seen any, instances where that's happened? And
that question comes up a lot because there's, we don't know of another situation where a nutrient, for example, even, that you can't get too much. You can't. But for omega-3s, we haven't seen it yet. We don't know what the upper limit. Eskimos ate for millennia, 7, 8, 9 grams a day. Did fine. We're in no danger of getting that close to that. We're trying to get people up from 150 milligrams a day, which is where our typical American, the average American intake, 150 milligrams. We'd like to get them to 500 or maybe 1,000 milligrams a day. That would be great. And then now you're talking Japanese levels, Spanish levels. So there's no question of safety in that range. When you get up to 5, 6, 7 grams, I mean, we gave, in our early studies in the 80s, we gave people 25 grams of omega-3 for a month. Okay. Nothing went wrong. So that's not a lifetime experience, of course. It's a short study, but we don't have any good evidence that there's a downside. People often bring up, what about bleeding? Because the omega-3s, one of their effects is to inhibit platelet function. Platelets help with they're the same cells that get affected by aspirin. When you take aspirin, it's to thin your blood. The omega-3s do a little bit of that blood thinning as well. Not as potently as an aspirin does. So they're, if you're not worried about an aspirin, you shouldn't worry about fish oil from bleeding. But there is no good evidence that omega-3s increase risk for bleeding. There have been many studies when people who have been on a high dose of omega-3 have had surgery, have had angioplasty, have had a catheterization of their heart, which requires going in through the femoral artery, a lot of blood. And they've studied how much blood loss happens in people on omega-3, even if they're on omega-3 and aspirin. So a combination of two anti-platelet agents. There's no increased risk of bleeding with the omega-3. So that's not a risk that comes up. One thing that happens in people who take a high dose of omega-3 to treat this high triglyceride level, typically their LDL cholesterol, the bad cholesterol, levels go up. As the triglycerides go down, the omega-3s, the LDL cholesterol will go up, which is kind of a seesaw. That's just the way it happens. And typically, we don't see that as a problem because the people in whom that happens start out with a very low LDL cholesterol level, and abnormally low. And so the omega-3, when you take the omega-3s, lower the triglyceride levels, the LDL level goes up, but it kind of goes up toward normal. It doesn't go up into the dangerous range. So that's, again, talking about side effects, adverse effects. Some would say the rise in LDL is a problem. I don't think it's a problem. So it's not bleeding, not LDL. And we haven't seen any adverse effect. I wish there was. I wish there was a place where you could take too much omega-3. Because then people would really want to know the blood level to keep that level below that level, but we haven't seen it yet.